Hello and good afternoon, everyone. My name is Hassan Muzzamil. I'm currently working as a locum consultant in Mullingar Hospital. It gives me great pleasure and honor to be part of this year's symposium, and I would like to thank Professor Anthony O'Regan and the Royal College for giving me the opportunity to speak. My topic is not an easy one. However, I will try my best to talk a little bit about my experience in working as a non-scheme, non-training doctor in Ireland. I want to start with a bit of background of myself. I am from Maldives. I graduated from Galway in 2007. I did my internship in Galway and I did a number of SHO jobs before securing BST. I completed my membership exams and did a number of years of registrar jobs, and currently I'm working as a locum consultant. It was a surprise to learn that internship was not offered to everybody in the class, and only a handful of non-EUs were offered internship. I had to wait for a year to get an internship place. This impacted in my future SHO jobs and getting a BST scheme. Therefore, I went on to do a number of standalone SHO jobs, and these were non-training jobs. Therefore, there were no feedbacks and there were difficulty getting study leaves. There were no mentors or supervisors. However, I managed to get a BST training scheme and completed my membership exams. So due to the fact that I was not able to get onto a training scheme, I took on myself to train myself. So therefore, I did a number of diplomas and I did a master's. So I did a postgraduate diploma in diabetes from British Medical Journal and Leicester University, and then I did a postgraduate diploma in acute medicine from University of South Wales, and I did a diploma in stroke from the Royal College, and I did a master's of internal medicine from University of Edinburgh. So when looking back on the challenges, the main challenge was being a non-EU citizen, and I was actively advised against applying for higher specialist training scheme by some people who are on the panel. They said that you are good enough to be on the scheme, but however, you need to have an Irish passport or an EU passport, and there's nothing they could do about it because this is an EU law and it's not an Irish law. And again, it was challenging to get access for study days and even to get places on essential courses such as communication and leadership. People are waiting for 3 to 4 years, and it's difficult to get spots on exams as these are prioritized for trainees. And when you are a non-scheme doctor, you are required to maintain professional competence, and this is an expensive process even though there is some reimbursement now. To get into research projects, QI projects, and audits and case reports is a challenge as well, because these are prioritized for the trainees, and there are no mentors or supervisors. There are no logbook or any structured equivalent pathway to achieve competency. I think it's worthwhile mentioning that anesthetic department have done a lot of work on this. They have a logbook for non-scheme doctors and they have an equivalent pathway for non-scheme doctors. In fact, they meet every year, an annual meeting in the Royal College, whereby there is a representative from the Irish Medical Council, there's a representative from the anesthetic department, and there is a doctor who recently achieved specialist division registration by alternate pathway, advising the non-scheme doctors on how to get onto the registrar. And currently they are working on issuing a certificate of completion of training for these doctors who are on non-scheme, getting trained by the alternate pathway. However, in medicine, this process is not clear and it's an expensive process. There is no encouragement or advice given on how to go into the specialist division registrar. I want to highlight this report from the Medical Council looking at the voluntary withdrawal from the registrar and registrations between 2016 and 2017, which was published last year in April, which shows that 43% of doctors who are on the medical register are trained outside of Ireland. And I suspect these numbers are possibly even higher now. And this is a graph showing the comparison between Irish graduate and international medical graduate across all divisions of people leaving the medical register voluntarily. And if you see, the blue color represents the Irish graduates and the green color represents the international medical graduates. And you can see that there's a high proportion of Irish graduates leaving the medical register voluntarily. And if you look at the bottom figure and you can see the table here, you will notice that the main reason why the doctors are leaving is to practice medicine in another country. This is an article from the Irish Medical Examiner recently published. This is a picture of Dr. Muhsin, who is a pediatric registrar in Crumlin, has done a lot of work and he's been in the media lately regarding access to training for non-EU doctors. And there's a group called Trainers for Ireland, led by Dr. Likar Rahman, who is a pediatric registrar working in Galway University Hospital. They did a survey around 400 doctors and looking at sufficient opportunities and chances for career progression for overseas doctors. And 98% thought that there were no chances or sufficient opportunities for career progression for overseas doctors who were on non-skimmed in Ireland. And only around 8% of people knew that there is an alternative pathway for career progression. So therefore we are getting state of nowhere. There's no career progression and there's no option to even go back home because there's no paperwork to show that we have achieved equivalent training and to get a consultant post. This leads to a lot of demotivation, and having to move your family every 6 months or every year from one location to another, changing the school of children, leads to a lot of problems and psychological problems with the children's well-being. So in summary, we need mentors, we need supervisors, we need logbooks and clear pathways such as the one adopted by the anesthetics. We need better access to courses and exams. We need specialist tuition registration process to be clearer. And we need to find a way to get access to training for all non-EU, non-scheme doctors. And we need to help everybody with career progression. I will leave this slide here. And thank you for listening. And I'm happy to take any questions. Thank you.